I am Dr. Cawthon, and I practice my specialty of ear, nose, and throat facial plastics here in Montgomery, Alabama. I was very fortunate that when I did decide to go into otolaryngology, I was ready to come to Jackson Hospital. My wife always has me projects to do, and she says if you don't have a project, you die, so I don't think I'll die anytime soon. But I like to hunt and fish, I like to travel, have dogs and cats and animals that we look after, and I play golf. I'm not a golfer, but I play golf. When I finished my training at Tulane University, I spent 2 years in the military with U.S. Army at Dwight David Eisenhower Army Medical Center at Fort Gordon, Georgia. While I was there, I was entertained by one of my fellow colleagues from the Tulane residency program who came here to begin a practice. And that practice was at Jackson Hospital. So I decided to join him in practice, and that was in 1977. So I came here from the military and right away was at Jackson Hospital. While in my last month of medical school, I was very fortunate to be at an elective where I was enabled to see the ear, nose, and throat world and what it did. You could do ear surgery, you could do facial plastics, you could do head and neck cancer, rhinology of breathing issues, sinus issues, and of course all that is still an evolving, changing field. The physicians who were at Dwight David Eisenhower Army Medical Center were my adult sponsors, if you will, and I was able to see ear surgery. What a marvelous thing to reflect back an eardrum, see the tiny bones of hearing, no bigger than the letters on the quarter that you use every day in the word liberty, and take some of those out and rearrange them, and then have the person wake up, have restored hearing. It was multifaceted, and that was one of the driving forces for me to seek out that specialty. I wanted to be diverse in what I did in my career. We do a lot of rhinoplasties, blepharoplasties, eyelid lifts, those kind of things. But we also do facelifts. Trademarked facelift called a quick lift is a novelty and a wonderful operative procedure. I like for it to be very personal, first of all. I like for it to be much that they participate in the discussion about what we want to do. There are so many things that are available today that were not available years ago. So there are a lot of plums from which to pick. And so I give them options of non-surgery and surgery, but I'm very realistic. I tell them, if I don't think that the injectable world or that something non-surgical is going to give them the quality results, I tell them we should think about a surgery. I want them to know that I'm very honest and sincere in my desire to give them a beautiful, natural looking result that they can walk away and be happy and smile with.